a wonderful episode of Monday Motivation. This is the Jamaica edition. I'm here live from Montego Bay, and as it is our custom, we are coming to you. It doesn't matter. It doesn't matter where I am. One of the favorite parts of my week is to spend time with you guys. So we're going to do Monday Motivation and Let's Talk NCLEX today. I love to be with you guys. Let me show you. Check this out. If it's your first time, my name is Regina Callion, and I am the #1 NCLEX instructor on this planet because I will go anywhere and teach NCLEX information. So I am here again in Jamaica, and I am just really, truly humbled by the environment here. I mean, I was in Kingston a couple weeks ago, and even though I'm coming back to the same country, there are different vibes depending on where you are. So in Kingston, the culture is like very business. It's like when I was there, it was like all about business. I'm in Montego Bay right now, and it is a place where the people here are so accommodating. They want you to enjoy the island. And like I said on Instagram, they work very hard. I'm thinking about the nurses here in the hospitals and how hard they're working. And I wondered to myself, can they take their families on a vacation? Do they have the ability to go away and take their families and enjoy the island? I don't know, but I do know this. Being a nurse, I'm able to do that. And it is such a wonderful experience to be able to take a vacation, to be able to meet new people. And so for you guys that are studying for NCLEX, I want you to think about it. I want you to think about what having your nursing license will mean. Hi, everybody. Hello, Melissa from New Mexico. I'm here in Montego Bay. Hi from St. Thomas. I'm close to you, Joan. But yeah, so of course, my Remar nurses are coming to represent. I'm actually speaking about the ability. Once you get your nursing license, you are going to be able to do some incredible things. I'm trying to tell you guys, Orlando representing here. Thank you for my Remar nurses. So I'm not going to keep you long. Today's topic is going to be act your age. Act your age for Monday Motivation. And you may be thinking, what do you mean, Regina, act your age? I'm talking to my Remar nurses about acting your age. And this is a special birthday reflection because some of you may know, some of you may not know, but my birthday was yesterday. So I had a birthday, and it was so cool because I was on my way to Jamaica and I was going to celebrate my birthday. And I'm telling you guys, normally when it comes to my birthday, it's kind of like every other day I'm working. But I had planned this whole big thing about on my birthday, I was going to really just take time, enjoy myself, enjoy, whatever I wanted to do. But because I'm a true Remar nurse at heart, I didn't do that. And my birthday became a lot about me reflecting on what is my responsibility now that I've been given a new year. So Monday Motivation, I'm going to talk about that. But I have an announcement because you guys know for 2019, we are going to be announcing winners every week. So I have 2 nurses that were selected this week. I'm going to tell you guys who they are. But the beautiful thing about it is that we will be paying for their NCLEX fee. So Remar is going to take care of their NCLEX fee. And you guys know the cost of that. So it's going to be a couple $100s that we will be able to invest into a Remar nurse because they have invested into themselves. So we have 2 winners this week because one of the Remar nurses who just passed their NCLEX, Nurse Shawnee, if you guys saw our Friday broadcast, she is giving back to our family. And so she's paying for a nurse to take her boards. And then I'm going to pay for a nurse to take their boards. So we just have double the prizes this week. So It's super easy to be registered. If you want to be in the drawing, all you have to do is purchase the full study comprehensive DVD program, invest in yourself, get that package, do the 6-week challenge, and we will pick a winner from that. So it's a really easy prize, and literally you don't have to do anything but be willing to invest in yourself. So the best kind of things. Thank you guys for wishing me happy birthday. I'm in Montego Bay. It's really beautiful here this week. So here is Monday motivation. And this is my thought for you guys. As we grow older, as we get older, what is our responsibility? What is the responsibility that we have when it comes to growing older? What do you think? And I know you guys are hearing the waves in the background, and I hope that it is peaceful enough for you to be able to just take this small journey and reflect on really what is important when you have been blessed with time, because that's what my birthday signified to me. My goodness, Regina, you have been given a whole year. What are you going to do? Are you just going to sit back and think about, all the ways that you're going to be enjoying life? Really, I mean, is there something more that you have a responsibility for? So I'm asking the Remar nurses today, because somebody's watching this and needs the motivation. What is your responsibility as you grow older? So somebody says, Regina, your best days are yet to come. Yes, I truly, truly believe that. We're talking about what is the responsibility of another year, another birthday, another time, another week, because this is Monday motivation. So what is your responsibility for another week? So here's what I thought. As you grow older, as you get older, thank you. As you guys get older, you have the potential to share two things. And these two things really are not confined by time. They're not confined by distance. They're not confined by standards or any man-made constructed things. Like, these two things that you have the ability to share can travel years and light years. And I mean, it can extend throughout your entire family, throughout generations. And it kind of hit me like, what is the responsibility of you guys, of myself, as we grow older for this week? So these are the two things. Okay. They are, you can share love and you can share knowledge. So this week, think about that. I mean, in the process of studying for NCLEX, getting your nursing license, imagine when you have that nursing license, what will be your capacity to share? What will be your capacity to share love? And love, how you share love can be many different things. Like, what I'm saying for the Remar family, you guys are sharing your love by investing into other nurses, right? You're sharing your love by investing into other nurses. We're sharing our knowledge by, telling people how we did it. I mean, Nurse Henny in the Remar group created videos of how she studied the DVD package. And so this week, as I was on my way to Jamaica, I thought, I have such a big responsibility to share my knowledge, because if I share what I know, even after I'm gone, that knowledge can still help another person. That knowledge can, cross borders, cross countries, cross divisions, cross racial barriers. And so this week, I really want you guys to focus on putting yourself in that position to share two things: sharing your love and sharing your knowledge. And so when you do this, the ability for your capacity as a human being, as an individual, grows, because you're not limited. You're not limited to what anybody is telling you to do. Like, one of the things I really love about nursing is that you can do anything when you I'm a registered nurse. You guys know that. And I run a company. Did I go to business school? No. But I went to nursing school. And you know what nursing school taught me? Nursing school taught me how to be really tough and how to manage a whole lot of crazy things and how to hold people's lives in my hands. And so really, when you compare somebody's life that you're responsible for, anything else is small. I mean, you guys can run companies. You guys can, travel. You can learn new languages. You are nurses. You can do anything. Once you get that nursing license, I'm telling you, I was talking to a lawyer today and she was like, I didn't even know that nurses could do that. I'm like, girl, yes, nurses do everything. We can do anything. We are not limited. We are not limited because our education prepares us to handle stress. And it prepares us to handle tough situations. All right. So I am looking forward to nurses working on the moon, nurses working on new planets. I'm telling you, if they discover a new planet, they better send some nurses up there because we know how to handle stressful situations. But anyhow, so for this week, you're positioning yourself to share love and knowledge, right? That is our motivation. Once we get that nursing license, we're able to do that. So think about how you're going to share your love. Think about how you're going to share your knowledge, because that is a responsibility as you get older. Like when you age, you are supposed to be wise in certain things. And so that's our Monday motivation. That is our Monday. Candace says, I love helping people. It's in my heart. Absolutely. Absolutely. So that's sharing your love. Alder says, I'm learning Arabic. That's pretty cool. That is pretty cool. Yes, I really want you guys to challenge yourselves and think about your nursing career as really just the leaping pad. Think about once you pass NCLEX, that's literally just the starting point of where you're going to end up. So I'm expecting really amazing things from you all. Okay. So now that we have our Monday motivation, are you guys ready? Are you guys ready for your NCLEX questions for this week? Come on in. If you guys are late, if you're late, you have to start where we are. So we're going to do some NCLEX questions. And these are just a couple things that I was studying over the past couple of days. And I really wanted to share. And I really wanted to dive deep down into some things. But Mark said, hey, Regina, oh my goodness. So, all right. So here's our first question. It was posted on the Facebook page. What do you guys think about this one? The nurse is to receive a client 3 hours post hip repair. Which roommate should the nurse assign this client to? So today we are doing roommate compatibilities. So we're looking for the best client to put as a roommate. So number one, a client with ulcerative colitis taking azathioprine. All right. A client with sickle-cell disease, malaise, and rhinitis. 3, a client with angina receiving nitroglycerin IV. And 4, a client with diarrhea admitting this morning. So which patient are we going to assign somebody who had a hip repair 3 hours ago? They need a roommate. Consider what you were taught about cohorting clients, and let's make the right decision here. Or give it your best at least, because I have a couple different answers that I'm seeing, and that's okay. For the majority, everybody's picking 3. For the majority, everybody's picking patient number 3. All right. I'm going to tell you guys the correct answer here. I like that. That's okay. The correct answer is going to be 3. Good job, guys. A client with angina receiving nitroglycerin IV. And this client is going to be the most appropriate because if you look at all of the other ones, there's issues. And so sometimes when you're trying to figure out who is the best person to go with this patient, break down every patient, break down all the other options that you have so that you can pinpoint who may not be appropriate. So I'm going to show you guys again here. For these clients, let's look at why number one, congratulations, Nikki, why number one is not going to be okay. So a client with ulcerative colitis, somebody with ulcerative colitis is having what kind of issues? What kind of issues are they going to be having? All right, they're going to be having potentially what? Like gastrointestinal issues. So diarrhea, maybe some irregular stools. That bathroom could be a mess. And our client just had a hip repair. So they just had a surgical incision. Do we want those two clients sharing a restroom? And actually, there's something important about this medication that the patient is taking. So what kind of medication is that? You got to know that too. All right. But even if you didn't know the medication, if you understood about ulcerative colitis, then you should be able to make a connection. And so that's what I mean when you really have your content as the backbone when you're doing these NCLEX questions. All right. So let's look at the other one. Now, two, we got a client with sickle-cell disease. All right. Is there any issues there with sickle-cell disease? Not so much, because that's not an infectious process. But what is going on with the patient right now? Right now, the client has malaise and rhinitis. So what does that mean? What does that indicate that this patient may be going through? Like they're feeling achy, they're feeling, lethargic, and they have a runny nose. So this person with sickle cell disease, although that may be okay, if you're feeling achy, your body's aching, you have a runny nose, you might have some sort of infectious process going on. I don't really want you in a room with my patient who just had surgery. Okay. So that's why we're not going to go with that patient. Now, three, we said okay, because three is having chest pain and all they're getting is nitroglycerin IV. All right. So they're clean, they're free of infection, and they're just having a stable, more than likely treatment process. Somebody with chest pain get a nitroglycerin IV. At this time, they're being treated for that chest pain. So we don't have to worry about any emergency situations right now. Number four, a client with, thank you guys. Look at my remark nurses. Sharing is caring. So thank you. Okay. So number four, you had a client with diarrhea admitting this morning. So this is a new client and they're coming in with diarrhea. I don't know what the diarrhea is from. So for that reason, I'm not going to put this patient in with a post-surgical patient when I have number three there. So it's not even like reading too deep. It's just like out of the questions, out of the options that you're given, who looks the best? And right now for us, that's number three. Oh my goodness, we have over 300 and something Remar nurses doing Let's Talk NCLEX today. It's a beautiful day here in Montego Bay. Let us move on. So when you are thinking about compatible roommates, it's very important to think about, okay, which of the two patients are going to have a similar condition, maybe even a similar treatment, but also you don't want the clients to negatively affect each other. So you have to think about, if I put these two patients in a room together, will there be some negative interaction, all right, that can harm the other person? So those are the ways that I like to look at compatible roommates, because you can get this question on your NCLEX exam Absolutely, absolutely. It's a part of management of care. RNs, you have to know who should go with who. Okay. And LPNs, you also need to know the understanding of the disease processes that would make two patients incompatible. So let me do some more practice on this. Guys. All right. I'm going to ask you this and I want you to tell me. All right. Let me know if these two are compatible roommates. We have a 10-year-old with diabetes mellitus type 1 plus a 13-year-old with diabetic ketoacidosis. All right. If NCLEX gave you these two clients, and asked you, were they compatible, what would your answer be? Oh, okay. So you guys are answering. Thank you for participating. Thank you. It's okay. If you're just joining in, we're talking about compatible roommates for NCLEX. And I like this topic a lot. To me, I find that it really tests what you know in terms of your content knowledge. And it does allow you to use your clinical judgment. So this is why this is a very popular question on NCLEX for my nurses. All right. So I see everybody's pretty much is saying, come on, Regina. Yes, these two are compatible. And you know what? You guys are right. Yes, of course. These two are going to be compatible because if you understand diabetic ketoacidosis, you know that can be an exacerbation of diabetes mellitus type 1. Yes, Charlotte, I agree. This is very important on NCLEX. So it is good that you guys saw the connection between the two. But if you haven't understood what diabetic ketoacidosis is, or if this is your first time seeing it and you can't easily define what it is, what the symptoms are, make sure that you take some time after this broadcast to look that up, okay? All right, let me try you guys again. Are you ready? This is Let's Talk NCLEX. I got 450 Remar nurses here. Oh, my goodness. All right, compatible roommates. Let's see. Let me try it again. Of course, in Montego Bay. All right, I'm trying to load up this slide for you guys. If not, I'll just tell you, but give me a second here.
You want compatible roommates?
Yeah, I do. Mark is here in the background too, trying to help me. But it is it. Did you do it? But just one more time.
Oh, the next one?
Yeah, the next one. See if it'll go for you. No, compatible roommates. It's giving me complications. And so when we were doing this, let me just tell you guys, when we were doing this, Mark was like, just jump on, do Monday motivation. And then after that, just tell the nurses you'll study with them later. But I was like, no, I really want to do this topic of compatible roommates. So, okay, well, Mark said that's not what he said. He said just do one or two. He did just say do one or two questions, which we did, but this was getting so good. Let me take it down. But of course, with technology, then this is how it goes. So what I can do, bear with me because I know you guys did say you had a lot of these on your exam. Let me try to, just bear with me. Let me try to see if I can bring it up again. Mark gave me he gives me a full written exam to try to give to you guys. You guys don't want this full exam, do you? Hold on one second. No, wait. Bring it down again. Hold on. Wait, I think we got it. Our patience has paid off. I do have it. All right, here you go. See, Mark is going to have me do a whole exam. All right. Let me see here. Let me bring it up. Wait, let me do it, Mark. Let me do it. Now it's gone again. Okay, hold on. All right. Here we go. Wait, I'll do it. Okay, it's coming. Thank you guys. All right, here we go. Okay. client compatible roommates. Here we go. A transgender female who has gone through puberty of the assigned sex with hypertension plus a female client who is 3 days post-MI. Tell me what you think. Tell me what you think. I know it's a lot going on. So here we got a transgender female client who has gone through puberty of the assigned sex with hypertension plus a female client who is 3 days post-MI. Oh, I knew I had to persist with this one. That's why I didn't want to cut it off, because I knew this one would be good. So I wrote this one today for you guys because I knew that it would challenge you. And I'm getting all kinds of different answers. Here, think about it. I want you to think about it. I want you to think about it. Okay, Remar nurses, the answers are coming in. Why are you guys saying yes? Why are you guys saying no? Why? What is it? What is it? Let me ask you this question, and I thank you guys for participating. I got a no, I got a yes, I got a no. Okay, all right, let's do this. Let me ask you guys this. Let me ask you this. Should nurses inform a roommate that they are sharing a room with a transgender client? So I want you guys to think. I'm digging you deeper. If you had a transgender, and the question here is this. You have a transgender female, and it says here the client has gone through puberty of the assigned sex. What does that mean to you? What does that mean to you? That the client has gone through puberty with the assigned sex. The client is coming in with hypertension. And then you have a female client who is 3 days post-op of an MI. Is the nurse supposed to say, you know what? There might be a client in here that, they used to be a man, but now they're a woman. And so we're going to bring them in there. Would you do that? Right? And I'm trying to get you guys to, you know it. Some of you guys already knew this. But no, not at all. You are not allowed to reveal somebody's medical history just because you want to. You cannot do that. You cannot do it. And it doesn't matter who the client is. So really for NCLEX, for your nursing license, for crying out loud, you have to maintain your professional conduct no matter who the patient is. And they are really cracking down on this. Okay. So I'm trying to really share knowledge with you guys here. So here, think about it. A transgender female client who has gone through puberty of the assigned sex with hypertension, and a female client who is 3 days post-MI. Okay? No. So let me tell you, you guys are saying no, you guys are saying yes. The correct answer actually is yes. Okay? The transgender client who has gone through puberty means that they have gone through the process where they have taken on the hormones, they have received the sexual characteristics of a woman, and they are living as a woman now. So they have made the commitment to their assigned sex that they desire to be. Okay? So if they're living as a woman, they have made a medical transition as a woman. Can we put them in a room with the male patient? Is that appropriate? Or would it be appropriate to put them in a room with a female patient? So let's start there. Okay. So in terms of the transgender client who has made a medical decision, who has gone through the transition, they are to be placed in, if it has to be, they are to be placed in the identifying sexes room. Okay. So this is why I put this on here. I know we learning today. All right. And then, so the compatibility there is yes, female, yes, female. So let's look at the diagnosis here. So we have the transgender female, they have hypertension. What is hypertension? Hypertension is uncontrolled blood pressure. So that's what we're dealing with that patient. The transgender, all of that stuff was really a distractor for you guys. I wanted to see how deep you could go with me there. Now we talked about the roommate. The roommate here is a female client who is 3 days post MI. So is this a stable patient? Is this somebody that is in critical? Is it somebody that, needs a lot of intensive monitoring? Probably not. 3 days after a heart attack. So we're looking at somebody that is going to be under the cardiology service or cardiology department, same as the transgender client, because they're in there with hypertension. So they actually are going to have pretty much the same treatment plans, the same treatment services. So yeah, these two are compatible. These two are really compatible. All right. So I had to do these with you guys because I knew that they would be educational and we would be able to benefit from them. But I don't want to stop there. Let's do one more of these, okay? Let's do one more like this and let's see what you guys think. Okay, so we have a client with a methamphetamine overdose plus a client who is hearing impaired. What do you guys think about these two? A client with a methamphetamine overdose plus a client who is hearing impaired. Compatible, or yes or no? What say it, you guys? And just think about the treatment, and then think about also, if you put them in a room with each other, will they negatively affect each other? Or will they be okay to go in a room together? All right, the Remar nurses are sounding off. And I thought I was getting a unanimous answer, but I'm getting some sporadic answers, and that's okay. We're talking about the client with a methamphetamine overdose and also a client who is hearing impaired. Are they compatible? The correct answer, thank you guys for participating. Share this video. All right. They are, no, they are not going to be compatible. They're not going to be compatible because, and I got these questions. Congratulations, Valerie. Says she got her second interview. Yes, Remar nurse. We are rocking it after we pass NCLEX. Hope you get that job that you're looking at. So if you think about the two kinds of clients, you have the client who has a methamphetamine overdose. So how will they be? They are going to be really on sensory overload. You need to provide those kinds of clients with basically silence. Like, they need a very calm environment. Whereas somebody that's hearing impaired, what do they need? They need buzzers and bells. Sometimes if you're in a room and there is a hearing impaired person there, when somebody enters the room, they press a button and lights go off, and the TV may or may not be very loud, but the person can't hear. So they're not going to be compatible. They're not going to be compatible in that way. All right. So did you get that one? It's going to be loud in there, and the methamphetamine client will not like that. So no, they will be, all right, not going to be great for each other. And I like that, Marcia. I like your rationale. The hearing impaired client may not understand. Really may not understand what's going on. The other client is going to be in withdrawal. They're not going to be a good mix of people together. Not that they're not good. I didn't mean that. They're not good. Not that they're not good people, just not together. Together. That's what I'm saying. Okay. Anyways. Okay. Before I go, I would like to do a pop quiz for you guys. And the goal here, I like to set some goals. The goal here is to get 3 out of 3 correct. Can we commit to that? Can you get 3 out of 3 correct? This is going to be on the topic of psychiatric nursing. So I'm testing you, and I want to see if you guys can do it. So I'm going to give you 3 questions. Just try to get them all right. That's it. Okay? All right. Okay. So here we go. The first question is, a nurse is caring for a client who had a failed suicide attempt. The client states, I am worthless. I cannot do anything right my entire life. Which is the best response by the nurse? Number 1, you were just trying to do your best. 2, how did you plan to kill yourself? 3, you have been feeling worthless for a while now. 4, why do you think you are a failure? What do you think? Remar nurses chime in. This is a pop quiz, psychiatric nursing at its best, NCLEX edition. Let's talk NCLEX, Jamaica edition as well. I'm getting the answers rolling in. I appreciate your participation. This is all for you guys. This is what we do here. We're bringing out the clinical judgment. We are bringing it out. Again, the client had a failed suicide attempt. The client states, I am worthless. I cannot do anything right my entire life. The best response by the nurse options are: number 1, you were just trying to do your best. 2, how did you plan to kill yourself? 3, you've been feeling worthless for a while now. 4, why do you think you are a failure? All right. And guys, the correct answer, number 3 is, you've been feeling worthless for a while now. Yes, this is going to be the most therapeutic response. Remember, when we're doing NCLEX questions, we want to look for those answers that are basically rephrasing what the client is saying, reflecting on what the client is saying. We really want them to be able to tell us more. Okay, so the clues that we got from this question basically come from what the client has said. The client says, I'm worthless. So we would want to ask them, you're feeling worthless? And I know it may seem silly, but that's what NCLEX wants us to do. They want us to dive deep into those statements. They want us to acknowledge our patient's feelings. And number 4 is saying, why do you feel like a failure? If you ask the client why they're feeling like something or somebody, you better have a response, because if you ask somebody why they feel like a failure and they say, or you ask them why they feel worthless and they say, because I just tried to kill myself and I'm still here. What is your follow-up to that? Okay, I understand. And then now it's like you're validating their experience of being worthless. And so, sorry, the vendor car, but it's just like, you have to be able to ask questions, but position yourself away from the answers as well. So you're not really affirming, or you're not really disagreeing what the patient is saying. You're literally allowing them to talk. So that's why number 3 is going to be the right answer. And it's okay, you guys. Okay, so number two, how did you plan to kill yourself? How did you plan to kill yourself? Why is that not the best response by the nurse? because the client it's not the concern. It's not the concern of the client right now. We already know it's a failed suicide attempt. We're moving on from that here. What NCLEX wants you to identify is to how to communicate with this client who has had the failed suicide attempt. They want you to provide a therapeutic environment for this client. I mean, if you asked in this scenario, how did you plan to kill yourself? What is that going to do for the client? What is that going to do? They had a failed suicide attempt. They're feeling worthless. And then the nurse asked them, well, how did you plan to kill yourself? You know, and so that's going to take the client down a road where they have tried it the first time and they didn't succeed. We already know. And at that point, it's a failed suicide attempt because we already know what they have tried to do. So it's no sense of us reliving that situation. Now, if this was a different case where NCLEX is saying your client is expressing suicidal ideations, then you want to know. You want to know on the front end how you're planning to do it. And that's maybe where some of you may have gotten confused. But here in this scenario, we already know that it was a failed suicide attempt. Okay. All right. And then number 1 here, you were just trying to do your best. You were just trying to do your best. So what's wrong? What's wrong with that response? Actually, with that response, you are not acknowledging your patient's feelings at all. And even though it sounds nice, it's actually very non-therapeutic because the client here is verbalizing, I'm worthless. I can't do anything right, right? That's what they're saying. I'm worthless. I can't do anything right. So if you say, oh, you was just trying to do your best and keep it moving, then that doesn't acknowledge the client's feelings of worthlessness, okay? So we want to make sure that we're always therapeutic. Remember, never ask why, and never not acknowledge your patient, okay, feeling. Let's try another one. 2. Okay. A client diagnosed with psychotic behavior spends 4 hours banging on the window, screaming, I don't belong here. Let me out. What defense mechanism is presented? Number 1, denial. 2, projection. 3, avoidance. 4, rationalization. And I want you to look at these words and make sure that you know what they mean. Every one of them, you need to know what they mean. So here we're joining together. We're doing some Let's Talk NCLEX right now. A client diagnosed with psychotic behavior spends 4 hours banging on the window, screaming, I don't belong here. Let me out. What defense mechanism is presented here? Thank you guys for participating. I see a lot of answers. Here. Oh, coming on in over 400 Remar nurses on this Monday motivation / Let's Talk NCLEX. It's a Remar party. It's an NCLEX party. We have it here every week. All right. The correct answer, guys, is pow, you knew it. Denial. Number 1, denial is a statement that something is just not true. The client here is saying, I don't belong here. Let me out of here. So they're denying the fact that they belong in treatment. So this was an easy one if you knew what denial meant. Now, if you didn't know what denial meant, or avoidance, or rationalization, then that would have been a tough question for you. Okay, moving on. We're looking for 3 out of 3. This is the final question right here. We got a client diagnosed with bulimia nervosa has Malu therapy ordered. Which is the primary focus? Number one, behavioral observations. 2, therapeutic exercises. 3, cognitive approach to learning. for learning or working environments. This one might be a little tough. It's the final question. It's all about Malu therapy. And you better know what this is before you take your NCLEX next week or whenever you decide to take it. All right. Give it a try. Give it a try. Gotta know it. Gotta know it. Better have that quick facts. All right. So a lot of different choices here. Seeing a lot of ones, seeing a lot of twos. Oh, yes. Oh, yes. And this one might be a little tricky, but that's okay. We're going to roll with it. We're going to roll with it. The correct answer for bulimia nervosa, all right, it is number 4. It is number 4. The learning and working environment of Malu therapy is where the client actually can take responsibility for their actions. So it's literally looking at the environment that the client is living in, that they're working in, that they're learning in, and allowing them to say, okay, when I'm here, and typically it's done in an inpatient setting so that the client can say, okay, you have all day today. You have bulimia nervosa. You have all day today where you're going to be living, where you're going to be receiving treatment. How would you like to build into a dietary plan that's going to be healthy and that is going to be successful for you? And so it is essential for the client to be able to do that if they want to be successful. Okay. So, Evelyn, I like that. I got it right because I studied it this morning on Quick Facts. Yes, I wrote these questions from the Quick Facts book. I was looking over it and I said, let me just pull out some content here and let me just make some questions out of it. And literally that is how you make NCLEX questions. You start from general content and you write a scenario based on it. And so you guys already know this. I tell you guys, Quick Facts should be your best friend in the whole universe when it comes to your nursing books. But also continue to study the content, continue to dig deeper, because everybody can, we can hear a nursing term and we can think we know it, but then if a question is presented, we get a little shaky. We don't go with our first mind. So if you were studying today and you kept changing your answers or second guessing yourself, don't forget to just review that subject so that you can commit to the answer. Normally, if you go with your first mind, it's right. It's right. So if you're taking your NCLEX exam and you just are drawn to an answer right away, just pick it and move on. More than likely, you're on the right track. You can do this, guys. You can do this. And that is one of the reasons why I'm committed. I'm your number one cheerleader. I really believe that you guys can do it. I love to be able to support you on this journey to getting your nursing license, because it is the most beautiful thing I think that can happen to you as career-wise goes to enter into the field of nursing. So right now, I want to announce our 2 winners for this week. We will be paying for your NCLEX exam. Okay, here they are. F. Bundu from Ohio, RN, and R. Moise from Florida, RN as well. You're going to have your NCLEX fees paid for by Remar. So you will be receiving an email from Mr. Mark Callion, and he is going to let you know how we can take care of you and support you when you get that NCLEX exam scheduled. When you're done studying, you've done the 6-week challenge, and you are able to sit for your exam. So congratulations, future nurses, your Remar family. We're saying congratulations to you guys. We will come back next week with another winner that we'll be paying for their NCLEX for as well. Shout out also to Nurse Shawnee, for real, because she is paying for one of these nurses. And I'm seeing this in our Remar study group where nursing students you guys are helping each other out. You're buying Quick Facts for people that you met in the group. You guys are really taking advantage of the family environment. So I'm just really excited and proud for you guys. I am going to be going live. I think we're going to go live from the event, right? Okay. So we're going to try to, you guys know the Nurse Success Summit is next week. It's on a Sunday, and it's all day event here in Kingston, Jamaica. Somebody asked, Regina, where are you? Well, I'm certainly not in Ohio. It never looks like this in Ohio. But I'm in Kingston, and just want to show you guys the beautifulness of it. And I came out here, and you know what? I came out here, look at, I don't know if you guys can see it, but it is absolutely gorgeous. And I'm here, I'm enjoying the island, I'm enjoying the people, but you know what? Like, I want you guys to be able to have the same experience. And I'm telling you, when you become a nurse, you will be able to plan vacations like this. I'm in a group of nurses, and I'm telling you, those girls, they vacation more than me. They go on cruises, they plan all kind of get-togethers, and I don't even get to make it to them. But I really want you guys this week to think about our Monday motivation, where you're thinking about, what is my responsibility to share love and knowledge, position myself to be able to do that, and then also dream big, dream so big. We love to hear from you guys. You guys know my email, support@remarreview.com. Reach out to us with your questions or comments, and we will see you next Sunday. I'm going to try to stream the event so that you guys who are not in the Kingston area can make it and see some of the happenings and hear some of the lectures that I'll be going over. It's going to be amazing. It's Sunday, and it's from 11 to about 6 p.m. So I'm doing an all-day event there, and I hope that you guys will be able to join in, say hi, encourage the Remar nurses that are coming to Kingston. And otherwise, I got to tell you this, you can, you will, and you must pass NCLEX. Bye, guys.